Case study for CCSP402, Eco-Anxiety in Finland. The discourse around climate adaptation has traditionally prioritized tangible infrastructure, yet the psychological resilience of a population is a critical, often overlooked variable in national readiness. The case study I have selected for this assignment is titled Support for Distress Associated with Climate Change in Finland, the Mind of Eco-Anxiety. This case study examines a Finnish initiative established to address eco-anxiety, which is defined as the chronic distress and rational dread associated with the escalating environmental and climate crisis. I have selected this specific case because it treats psychological well-being not as a secondary health issue, but as a primary adaptation measure necessary for sustained climate action. Eco-anxiety represents a persistent fear of environmental cataclysm and serves as a rational response to a systemic problem characterized by high complexity and an absence of immediate centralized solutions. Psychological manifestations can range from profound grief and guilt to clinical symptoms such as persistent insomnia, obsessive thinking, and panic attacks. The Finnish approach is anchored in a philosophical play on words, using a term meaning both mind and meaning. I believe it's pronounced melee, but I'm not sure on the pronunciation of it. This dual focus suggests that the objective of adaptation is not merely to alleviate distress, but to help citizens derive a sense of meaning from their climate concerns. This initiative was a bottom-up measure established by social work and mental health professionals who identified a significant gap in the national health framework. The project was a collaborative effort between three major non-governmental organizations specializing in ecological emotions, student welfare, and national mental health. The program was supported by 640,000 euros in funding from the National Funding Center for Social Welfare and Health, known as STEA. The resource allocation allowed to the project to operate for a 3-year term from 2020 to 2022, providing all specialized services free of charge. The implementation strategy utilized a 3-pillar framework consisting of awareness, support, and education. The awareness pillar focused on destigmatizing environmental emotions and recognizing them as a widespread societal phenomenon rather than an individual pathology. In 2021, they launched a high visibility campaign titled Let's Talk About Eco-Emotions, which received formal endorsement from all national mental health organizations. They established a comprehensive digital repository containing scientific literature, psychological resources, and various psychotherapy approaches tailored for an environmental distress. Targeted communication included podcast series addressing complex topics such as the intersection of ecological uncertainty and reproductive decisions. The awareness campaigns were remarkably effective, generating approximately 3.5 million views across digital platforms. In a country with a population of only 5.5 million people, this indicates that the project achieved significant national penetration and visibility. The second pillar provided direct clinical and psychosocial support through a structured, group-based intervention model. These groups focused on emotional regulation, the development of coping mechanisms, and the cultivation of a supportive community of peers. Interventions typically consisted of 3 to 5 sessions led by professional facilitators with the expertise in social work or psychology. While the program was open to all, it specifically engaged young adults aged 20 to 30, with hundreds of participants completing the workshops by 2022. The methodology prioritized group dynamics, allowing participants to move beyond data-driven fear and toward value-based action. The third pillar focused on systemic capacity building through the education of frontline professionals. The project trained nearly 1,200 professionals across the education, healthcare, and social work sectors. These intensive sessions equipped educators and clinicians with the diagnostic and communicative tools to address eco-anxiety in their professional environments. They produced a specialized information pack for teachers to facilitate classroom discussions, which was later translated to expand its transnational reach. A key factor in the project's success was its departure from traditional low-impact health communications in favor of a more creative, high-engagement media. One notable success was the involvement of a public persona known as the Shouting Man, who used rhythmic vocal performance to symbolize the environmental emergency. This unorthodox approach was strategically designed to cut through the media saturation and emphasize the urgency of the climate health nexus. By 2021, the project's impact was formalized at the policy level, when the Ministry of Social Affairs and Health included climate anxiety in the National Adaptation Plan. Despite these achievements, the project faced constraints, most notably the transition to digital platforms necessitated by the global pandemic. The move to virtual workshops made it more difficult to foster deep interpersonal connections required for processing complex environmental grief. The project also identified a significant participation gap among rural populations and the agricultural sector. Despite being directly impacted by shifting climate patterns, farmers did not engage with external mental health services in the same manner as urban populations. This led to the realization that for the primary sector, emotional support must be integrated into existing community structures rather than externalized. Furthermore, activists already engaged in the climate work were often in a state of hyperarousal or crisis mode, making them less likely to pause for emotional processing. As we translate these findings to the New Zealand context, several strategic implications emerge for our own national adaptation strategy. First, we must address the specific needs of our rural communities by embedding climate resilience training within established agricultural support networks. Aotearoa New Zealand's reliance on the land means our primary sector requires support that is culturally and professionally resonant rather than purely clinical. Second, the Finnish philosophy of mind and meaning provides a bridge to our own holistic health frameworks. This approach aligns with the 4 pillars of well-being in the Te Whare Tapa Wha model, framing climate distress as a disruption of spiritual and social health. By integrating eco-anxiety into our established models of health, we can address the mental toll of climate change without pathologizing a rational response to environmental loss. Finally, we should prioritize the training of our educators and school counselors to manage the increasing prevalence of climate-related distress in our youth. Developing a localized version of the Finnish educational guides would provide our schools with a standardized, science-based approach to psychological resilience. Ultimately, the Finnish experience demonstrates that national climate readiness requires more than just physical defenses. It requires a population that's psychologically equipped to manage uncertainty and grief without losing the capacity for collective action. Building a resilient nation begins with building resilient minds. Thank you for viewing my video presentation.